Okay, it's 8 o'clock and my students are not here. So there's no other way. I have to wait for them. And what? Patience. According to that, we're gonna continue tonight. So I'll be back when the first student gets into in order to start because, well, I was planning to start tonight on time and finish on time. Well, great. Good night, Elena. Elena, good night. Can you hear me?
Yes, teacher. Good evening.
Good evening. How was your day? Everything okay?
Sorry?
Everything okay, I mean?
More or less. Yesterday I couldn't. I had a problem, but now, well, I am here.
Well, yes, you are here. That's a good point. You are the first student here, so let's wait your classmates until 8 and 5, 3 minutes more, okay?
Okay, teacher.
If they arrive or not, we are going to start together in 5, okay?
Okay, okay. Thank you.
Okay, so see you in 3 minutes. Good night, Laura and Dorian. Well, 8 and 5, let's start the class, okay? Because, well, it's gonna be later and, well, we don't want to be later than. Let me share a screen and then we start the class, okay? Well, as you know, next week is going to be the final test. And we only have 2 theoretical classes that at this point are, of course, important because we are catching more vocabulary from this point. In that way, tonight we are going to check medical practitioner 1 and 2. I divided them, these ideas, because of all the concepts they have. Okay, so we also are going to talk about nurses and allied medical professionals. Of course, they are important. Why nurses are not into the allied medical professionals? Because nurses are our right hand, I think. Without them, we cannot work properly because we as doctors give the orders, give the instructions, make a control. But the one who develops all of these actions and orders are nurses. That's why I decided to check their profession in a very different view. Okay, let's go ahead. Medical practitioner 1. We must get in mind these concepts because are important in order to catch meanings, to talk properly, and understand more abbreviations. Medical practitioner is a doctor who must be qualified. I mean, a doctor who finished the university and has a degree in medicine. And of course, has to be registered in order to practice. Registered could be in the government places, like here, the health ministerium, in order to catch the number of register. Without that number, you cannot be called a medical practitioner, right? A clinician is a doctor who develops research and treats patients. I mean, for becoming a clinician, you have to take some specific courses and get qualified for catching the information in a properly way. Of course, all doctors, we all have the chance to catch this kind of information, to collect, to make, I don't know, the statistics, to collect numbers. But if we are not sure how this process must be done and how the periods in time are created, are elaborated, you cannot give a result in the way we expect. That's why to become a clinician requires at least 2 extra years in studies that are different from the medical practitioner, from the doctor, different from the university degree, from the first step. During the whole model, we were talking about the general practitioner. I mean, in Spanish, médico general. That's the one who provides primary care, the one that is into the consulting room, into the community, in order to control and maybe catch some chronic or acute diseases and illnesses, in order to organize the population easily, and is the first step into the whole branches in medical structure. We are going to talk about it in the next class. The abbreviation is GP. Always you check GP following the context, you know that it's about a general practitioner. And of course, GPs, general practitioners, work in a group practice. The group practice is the general practitioner, the nurse, and the auxiliary, okay? They, as a team, have the chance to organize all the activities where the patient certainly needs, and then it's easily to make the job, okay? When we talk about the specialties, we must consider this. All of them generally work in hospitals. The specialists are especially into hospitals. We all know about it. But they also have the chance to practice private healthcare and may have consulting rooms outside the hospital. I mean, a personal consulting room when they receive their own patients and continue their job in the private branches. As a general view, we can see that we have 2 principal branches in medicine: surgery for surgeons and internal medicine for physicians. Doctors who develop non-surgical procedures, I mean. This information, the forward names, are just for catching the idea and the meanings easily. Names of the specialties usually end in ology, for example, oncology. Names of specialists usually end in ologist, for example, oncologist, doctor who develops oncology. Name of specialty ends in ICS, for example, pediatrics could be. And name of specialists ends CN or ION, for example, physician for internal medicine or surgeon for surgery, right? We as doctors, well, through the whole career, we have the chance to think what kind of branch will certainly make our best. It's not only the place I feel better, it's the place where I work the best and I can give a great result. For example, in my personal situation, I never liked gynecology and obstetrics. It's not for me. It's not a branch that I could study because I don't feel comfortable in that kind of job. But going through practice, in order I don't like it, I studied it harder for catching as much as I could, and I can develop a good job. So it's an example. It's not if you like or not. It's the place you develop the best, and then following and being practical, you can choose the branch. You can certainly give a real answer about the necessities in your own situation, in your own country could be, or the place you live or you plan to live. As you can see in this picture, you have lots of abbreviations that are showing you details, because abbreviations in medical English are in everything. This chart is a kind of joke, but when you certainly think on this, maybe you have the possibility to catch the specialty following easy and funny questions. For example, what's the problem? I like everything family medicine. We all know about it. I like nothing. How are your grades? Do you like people? Yes. Are you willing to touch them? No. Become a psychiatrist. Or yes, become a PM&R, physical medicine and rehabilitation. If your grades are okay, are you a huge nerd? Yes. Become a pathologist or become a neurologist. Okay. Just average, you can say what do you think of kids? I love them, of course, pediatrics. Love them for first 2 minutes of life. Okay, obstetrics and gynecology. Take the baby and get away, right? Or you can say they smell, or you can say like them if asleep, anesthesiology, of course. How do you feel about sleep? Could be. It's funny. Need it to live. So, do you have ADHD? Emergency medicine is my branch. Actually, I have ADHD. That's why I can focus on many topics, and it's funny for me to be there. It's not a stressing place. I feel relaxed in the emergency room. Or do you still don't know what to do? Okay, become an internal medicine, right? A physician. It's just a joke, but when you catch this, you can see lots of names of specialties, some abbreviations that are important, and are the way when you can find them into the hospital. ME or A and E is the abbreviation for accident and emergency room, for example. So let's consider this for practicing vocabulary. Talking about medical practitioners too, the division I decided to make is because now we are going to talk in group, how these groups of jobs, how we develop our actions into the hospital, okay? The staff, as a general word, means people who work at any place or at any type of workplace. I mean, you have a hotel staff, hospital staff, I don't know, the stadium staff, the airport staff. Staff as a concept is people who work at any type of workplace as a team. They have to make activities in coordination. The medical staff, of course, has a team. When we only talking about just about doctors, we have all of these steps to follow. For example, at the beginning, we all were medical students. At this point, we have classmates that are medical students in second and third year. We all had the chance to be interns when we are almost finishing the last year of the career. And while finishing, here we have a cut. Here becomes the general practitioner. You get all your registers, you take the test for becoming into the resident course, and then you become a resident. The physician, the doctor that is getting prepared into the specialty you choose. When you finish your residency, you become a fellow. The specialty that is in a period of training, because you have to acquire more capabilities. And then with all of these extra capabilities, you can give more tests, you can start working with your second register as a specialist, and then you become an attending. Attending could be the room chief, the chief of the service, okay? The attending is in this chart is one of the last process when you study and have the chance to be the professor of all of them. You are the responsible of everything. When you receive a new patient, it gets into for example, the emergency room, it gets admitted into the hospital. The medical student and the intern start taking the all data and prepare the clinical report. The resident makes the evaluation, continues and starts giving the diagnosis. And they three as a team have to give the whole information to the fellow. The fellow checks everything, corrects detail, and during the round, the ward round, they talk to the attending because he's going into the period of ward round to evaluate the case and maybe change details or correct some details. That's the way it works. We all know about it. In this chart, we only have this example about the use of hospital staff hierarchy. When we consider all of these details, the dean, the chief of everything, the hospital administrations, and then the specialist surgeons. Why specialist surgeons are the third pillar of this? Because from surgery are coming almost all the guidelines we have at this moment for giving attendance to giving assistance to people that really need our job properly done. Okay, in the emergency room, we decide goes to the surgical room or goes to rest into room. It's easy. You follow a protocol, and that protocol is developed by surgeons in almost all of the cases. Then normal specialist is according to clinical specialists, for example, internal medicine, ophthalmology, well, branches that you don't have to be into the surgical room because according to your activities is living or not, but that are the normal specialties. The silent doctors are colleagues that are in the process of evaluating, in the process of practicing and receiving the registers. They have the chance to continue working in the hospital as helpers because a pair of hands is always welcome. And you have the chance to practice there and give your experience and don't forget details and acquire more capabilities. Then becomes nurses, then physician assistant. The physician assistant is a general practitioner who's getting prepared for becoming a resident and then being the support of normal specialists or surgeon specialists. Then becomes the students, medical students and interns, both of them. A similar situation is in Australia. In Australia, you have senior medical officer. It's a group that is giving the guidelines to the hospital. And then you have general practitioners. Why general practitioners? Because we are the basis of almost everything. So we have to consider that we certainly need the staff specialist. I mean, all of the chief of the specialist rooms are in this staff. And then the career hospital doctors, I mean the professors. Then the visiting medical officers and registers are administration staff, principal house officer and resident medical officer. Both of them are the chiefs of different groups of students that are getting into the residency course. And then we have the senior and junior, and then the intern. Senior and junior are the years of residency course. Well, this is a very general chart, and we can check a very similar organization, but now in Bolivia, just for catching the idea that no matter the place you are, you have your own, you have your specific place, and you have to realize that you don't have to go extra to your responsibilities, or you don't have to catch extra responsibilities than the ones you certainly need. You are prepared for doing this, okay? So they are just examples for contrasting ideas, but it's interesting to check how these differences support that we all are a part of a group. We cannot work alone. About medical teams, we have to consider this. A team is a group of junior doctors to healthcare patients of the consultant physician and surgeon. I mean, a medical team, for example, when you check Dr. House, you know, House is the leader, is the chief. He has 4 doctors that are going to him and giving information about the patient, making research, developing procedures. Well, the medical teams prepare all of this information and go to the chief, and he takes the decisions. All of them are doctors, but one is the specialist, is a professor, and the team could be a specialist with less years in action, or could be residents in the last year of the career. That's the way they work in US and UK. The multidisciplinary teams, of course, are groups formed by doctors and allied medical professionals. I mean, physiatrists and nutrologists, laboratory technicians, well, all of them that are not doctors but work with the patient, and with the complete information we can reach the diagnosis and support our idea. This slide is very important. Please study this vocabulary in order to catch the new words that are in capital letters, because from this slide I'm gonna take information for homework and final test. I'm telling you, I'm giving you the information where the questions are coming from. When a patient enters to a hospital, or in the properly way, when a patient is admitted to a hospital, they are usually they are seen first by one of the junior doctors. I mean, the doctor that is in the emergency room, that could be first year in the residency course, or a general practitioner that work in that place. In USA and UK, they are called junior doctors. One of the junior doctors on the ward where they will receive the treatment and care. Here in our emergencies in Bolivia, I think in all Latin America places, in hospitals, in the emergency rooms could be general practitioners. We are junior doctors. We don't have the complete studies and capabilities to work as a specialist, right? But when we receive a patient in the emergency room, we have to start a treatment. We have to start the support, and we don't have to avoid the patient. No matter the diagnosis at this point, we start with all of the activities we have on hands at the moment, and it's possible to do it. The junior doctor clerks them. I mean, takes their medical history, makes the anamnesis, takes the information really needs, takes the affiliation chart, and examines them. I mean, makes the physical evaluation in order to look for the first diagnosis at the moment to get into the emergency room. And of course, this diagnosis can change through the time, can change according to the lab tests we receive, to the imaging tests we ask for, and then the results we receive. Sometime later, the register also sees the patient and may order investigations or tests. In this paragraph, the register could be considered a resident or a doctor who's a step ahead from us. Okay. The register, well, order investigations and tests, for example, X-rays and ECG, and make a provisional diagnosis. This provisional diagnosis is done from the first evaluation we made and the evaluation that he makes by his own, and continue or begin the treatment or change the treatment according to the situation. The consultant is the specialist who is on ward, usually sees the new admissions, people who have recently been admitted to the ward, for the first time on one of the regular ward rounds. I mean, that period of time when the consultants, the specialists go in group and evaluate patient by patient in their beds, and then according to that information, they decide how to continue, if the patient stays in the hospital or goes home, okay? The ward rounds, of course, have a schedule. We all know about it. We all have the chance to live them, and we know how stressful activity it is, but it's possible to make it. When the management of the patient is discussed with the register, of course, the register, the resident, the doctor who's giving the information to the consultant supports his ideas, supports his medical thoughts, and then the consultant checks if it's okay or not, and then changes everything he needs. Consultants also decide when a patient is ready to be discharged. I mean, ready to go home or to send home. On the ward round, the consultant is accompanied by the team, the medical team, and a nurse. We all know that usually is the chief, the nurse chief, the big one of the service. And they visit all the patients in the consultant's care. The consultant is the specialist, the responsible of the service. Usually the ward rounds are in 3 times, morning, afternoon, and night, according to the situation. Could be closer, could be later. Well, it's according to the diagnosis. Talking about shifts, this great activity, I say great because I love to be on shift, is of course the activity that is scheduled and rotating in hours and days previously agreed. I mean, it's according to a role we choose with our colleagues, and then we have the chance to be on a specific days or maybe changing days. Okay, we all know the shifts are so hard, but they are necessary to take care. And during the shifts, we can be the junior if we are in the emergency room receiving the patients. We can be the register if we are supporting our job and talking to the specialists according to the place you work and live. Let's talk about nurses. Nurses, of course, as I was telling you, are our right hands in my personal opinion. And of course, they have grades. They are not, you don't become a nurse and that's all, that's it. No, of course, you have to continue in your studies because it's a very different career from medical career. And well, you have to take it in count. The student nurse, a nurse who's still in training, the staff nurse, a nurse who has completed the training course, a charge nurse, a more experienced nurse who's in charge of or who's responsible for a ward or department, or a nurse manager, a nurse who's in charge of several wards, or could be of the whole hospital if it's a hospital, right? Now we say nurse, but when we started with this career, I mean, the nurses started working with doctors is from Second World the second or first? No, the First World War. Usually, well, nurses at the beginning were volunteers, ladies who decide to go and help in the war camp, and then they have to assist soldiers who were with lots of injuries and, well, many situations. The first nurse, the first lady who established that it could be a new profession was Florence Nightingale. I mean, maybe you had listened about her, but she was amazing because she get in mind that just washing hands and changing clothes of beds and changing patients' clothes, they can reduce significantly the range of deaths, okay? When volunteers started going to the war and were not enough, then the church decided to send nuns, to send mothers. These ladies who are living just for God, I mean, well, it's their own idea. And in that moment, well, there was a period in time when only, well, the whole nuns were just nuns. And through the history, if you have the chance to talk with an elderly professor, maybe the professor could say the nurse mother. Mother, for example, Mother Juanita is the nurse in charge of the hospital, is the nurse in charge of internal medicine. Why mother? Because of a medical tradition just. Now, nuns at this point are not nurses, at least not in this country. But if you hear that, it's because of that period in time, because our history. Well, as I was telling you, into this career, you have lots of different branches in nursery. For example, you got the support workers, a nurse who has done a short course and obtained basic qualifications. I mean the auxiliary. Nursing auxiliary assists nursing staff. It is the lady in white clothes that is going ahead, changing, preparing material, or cleaning the patient, well, doing something with their hands, just a small report. And the ward clerks. The ward clerks is the nurse, the auxiliary, that ensures that all the information of the patient is organized in the medical file, in the medical report. I mean, they take the general information, the full name, cell phone, email, location, and all the information they certainly need in order to get the file complete. The first boxes of the history get completed and answer the telephone. If the call is so important, they talk to the doctor and take a decision with him. In our country, ward clerks are also nursing auxiliaries, right? But in UK and USA, ward clerks are specifically for these activities. For example, if in a clinical history, form is lost, the ward clerk has the responsibility to find it or to make it again. Okay, we know about it. It's a loyal information into the clinical record, so we certainly need a responsible for getting everything in order. Also, nurses can become into specialties. They can become midwives, district nurses, or health visitors. Midwife is the nurse who has the capability to start the management of pregnancy and childbirth. I mean, they can follow the pregnancy at home, and they are able to find some complications and send the patient to the specialist or the general practitioner according to the place in order to catch in a better way to organize, in a better way, the patients. And childbirth, of course, when the baby borns, we know if it's so urgent or it's a real emergency, the midwife is prepared to assist the delivery at home, okay? The district nurses are nurses that go home by home visiting patients that can't go to the doctor, to the general practitioner in the community. They have their own role, they have some activities to follow on, and according to that, they have a role for going home by home, checking or maybe taking the medication or controlling vital signs, or controlling all the situations they certainly need. Health visitors also work on the community, but they go advising and teaching the people. I mean, they have activities on promotion and prevention, okay? Promotion of health and prevention of illnesses. They go and teach and teach and teach all the time, communities, schools, I don't know, elderly residences, daycares, in order to prevent lots of situations, right? About the nurse's role, we know they take care of patients, they check temperature. Oh, I'm sorry, typing mistake. They take vital signs, they change dressings, give shots, injections. Well, of course, in general words, they have their own activities. But in first world countries, for example, USA, actually, they have the chance to remove sutures, to prescribe some drugs, to order lab tests, to take away or take biopsies, to remove cysts, in order to help doctors and not get a crowd into just one doctor. It's different in our countries, but for catching an idea, now nurses are catching more responsibilities and they have the chance to improve their job and show that they are really prepared to do this. This is a general hierarchy structure about nurses in a hospital, just for information, don't worry about it. Talking about allied medical professionals, as I was telling you in previous slides, are all the professionals who are not doctors, but work with patients. Patients who are prepared on medical branches, and they help us maybe to recover the health of the patient, or to prevent some situations, or to treat at the moment some other situations. Well, we know. Into the community health, we have to consider the physiotherapist, the physios. Physios are professionals that help people to move by getting exercises or treating their body with heat or massages. I mean, manipulating muscles and joints with hands, like in the pictures, or some devices, right? Physiotherapists assist people that have the chance to recover without any trouble. I mean, make their process, make their dates, and at the end of that, the patient is recovered without any consequence, anything, right? A different specialist is the occupational therapist, the OTS. People, professionals that help people with disability to perform tasks at home and at work. I mean, occupational therapists are not the same than physiotherapists. They are different. Of course, the one who studies this profession is prepared for becoming a physiotherapist or an occupational therapist. That's great. But in some places, in lots of countries, they have to choose where to work. They cannot develop both activities. If you become an occupational therapist, you have to be clear that only the chance of working is people with disability. Okay, so being clear on this, they can help children with some situations, maybe a patient that lost a limb to walk again now with the prosthesis, or people with, for example, a stroke, okay? The disability is a physical or mental condition that makes it difficult to live normally, okay? Blindness or deafness could be an example. The OTS are very useful, but of course they have lots of job. Now, social workers, sometimes we don't consider them into the medical allied professional, but actually it is. Social workers help people to solve their social problems or to catch their social problems and try them to organize life in order to improve in a huge world, I mean. They can help, for example, housing or unemployment or family problems. They can be the bridge between the problem and the solution, because social workers have the chance to to get in contact with maybe OTS if they need it, or physios if they need it, or another specialist, or they have the chance to help people to make all the papers in order to change to another hospital or to another district, who knows. But they are the branch of doing this. They are the branch of recovering or taking back resources about employment. In lots of countries, if you have the chance to get the recommendation of a social worker because he's supporting that you have the capabilities to do that, it's almost like a rule that you get that job. Instead, you didn't give your files, or you didn't have experience at the moment. If the social worker is supporting you, you have a plus. And that's the detail. Another one are the chiropodists or podiatrists, that people who treat conditions affecting feet, for example, like this. Of course, it's a career that requires studies, that requires time of evaluation, because no, you cannot ensure that your patients can take this care by its own. I mean, a diabetic patient could develop lots of troubles, for example, the diabetic foot, and then lose the limb, right? If the podiatrist makes a great job and takes care, starts a role and makes the all activities the patient needs, there's no trouble on this. It's just an example. Then we have technicians. Technicians, as people who work with scientific equipment, okay? People, of course, they are careers. They are very well prepared, well trained in order to develop their activities. X-ray technicians, the radiographers, are not the same than an immunologist, okay? The X-ray technician is that guy who takes the patient, prepares the patient, takes the X-rays, and then the picture is sent to the specialist to make the reading and make the inform about it, okay? The technician is responsible to set the equipment, all the devices, and to prepare the patient properly to take the best picture. The ambulance technicians are people who work on the emergency medicine service. I mean, people who drive the ambulance, who help to change dressings, who cleans all of these devices. The ambulance technicians can help to pick up the patient, but they are not allowed to assist the patient in their home or on land. They are not prepared for doing that. They have a limit on their activities, on their capabilities, just the basics with them. The paramedic is an ambulance technician with more advanced qualifications. For example, the ATLS is the qualification that a paramedic requires in order to stop just driving and start assisting the patient with all the devices they have. Why they really need more qualifications? Because they give provisional diagnosis and they start with fluids, with analgesics, they place some splints, they can make immobilization, they decide when to start oxygen, for example. They decide when to pick up a patient from home and then go to the hospital. It's very great activity to do this. And of course, you have to be in a very great physical condition to consider all of this. Then we have prosthetists or orthosists, people or professionals who provide care to everybody, to anyone who needs an artificial limb. You can see here, who needs prosthesis or device to support or control a part of the body, the orthosis. Okay, the prosthesis for changing the limb. I mean, if you lost the foot, you can change with an artificial limb, or the orthosis are these splints in order to control the situation, and then you can get back to your normal activity while finishing the treatment. They also advise on rehabilitation. Why advise? Because the protesist is the one who decides how to prepare the specific material to the specific patient. And well, I mean, all over the world, we have the chance to buy splints, but as a general view, but the best way to get the splints done is when they are prepared for your limb, your size, okay? Not for everybody, not for just preparing and everybody can use this. No, it's not the way it works. The splints we know, range of splints and other devices to aid movement, correct deformity, and relieve pain. We all know about it. Then we get opticians. The opticians are not the same as ophthalmologists. Ophthalmologist is a doctor who gets into the specialty ophthalmology and then is prepared to assist pathologists, eye pathologists, right, or sight pathologists, or make a surgery, right, in the eye. Opticians are that professionals who are prepared to test eyesight and prescribe glasses. Why they have this capability? Because they only are trained to use all the devices they certainly need. And well, test eyesight and prescribe glasses. A synonym of glasses, spectacles, okay? And contact lenses, of course. We were checking in previous classes that the examination includes the intraocular pressure and examining the retina. They have the capability to do that. Of course, using this chart for catching the visual acuity or checking the structures that are surrounding the eyeball. And if there is a suspect of an eye disease, the patient goes to the GP. I mean, the optician has not the capability to send the patient just to the ophthalmologist. In some countries, for example, almost whole places in Europe and USA, you go to the optician, catch a problem. The optician advises you to go to the general practitioner, and then according to the general practitioner opinion, it's the guy who decides if you go or not to the ophthalmologist, or if he can give you treatment and correct the situation. You can see it's a chain. It's a step by step we have to follow, and following the chain, we can get all the information, right? And don't forget, our Sir Brian Tracy said, practice is the price of mastery. Whatever you practice over and over again becomes a new habit of thought and performance. So keep on practicing, keep on reading, please study to the final test, make homework. From homework files are coming all the questions to the final test. Let me send you the poll to take attendance. And according to that, I'm gonna, well, during that, I'm gonna give you the presentation. Let's talk about the final test a little bit, because during the final test, we have the chance. Okay, can you all watch the poll? I send it.
Yes.
Okay, great. Start filling this. As I was telling you yesterday during the class, during the workshop, I mean, the final test is gonna be on Tuesday. I mean, tomorrow is our last workshop. It's the last chance to make questions about any presentation. On the other hand, in the final test, I need your cameras turned on. And well, everyone has to come with your camera opened. And okay. And without microphone, of course, I have the chance to get in silence the class if you need it.
May I ask you a question? When is it going to be, the test?
On Tuesday. On Tuesday, in 1 week.
Yeah, okay, thank you.
Yes, well, when we started the course, I told you that finishing this, we have the chance to do it. Okay, Laura, tell me, you raised your hand. Laura?
Yes, teacher, sorry. At what time is it going to be the test? Is it going to be at 8 p.m.?
Yes, at 8 p.m. Same schedule as theoretical class. And we all together with cameras turned on, it's gonna be, well, it's gonna last 2 hours. And it's the same, I'm gonna send you the test to the chat, you download it, and you have the chance to print it or send me back the answers. There is no trouble on this. It's because of the institution rule, it only has the chance to last 2 hours, no more than that. Okay. So let's do this.
Thank you.
I'm gonna send a message tonight to the group by WhatsApp in some minutes, giving you the information about the test. Okay. Any other question, maybe any other detail to talk about? I upload the presentation, the PDF, to the chat. Please start downloading it. If you cannot, let me know now in order to send it to you.
Teacher, I have a problem with my cell phone. Could you send me the box, please? I can't download this, please.
Okay, Elena, no worry. I know that sometimes it happens with your cell phone.
Thank you very much.
Any other one who has that trouble, maybe? Can you all feel the pull? Because you know it's attendance. I can take my chart, but if the academic supervisor checks that you didn't feel the pull, it's as if you were not in class. I told you it at the beginning. Okay, great, Pablo. All of you had the chance to feel the pull. Please let me know now in order to correct the situation and talk to the academic supervisor like at the beginning. At the beginning, some students told me that couldn't feel or send the answers. And with a screenshot, I support that you were in class and you didn't lose that attendance, I mean. Okay. All of you feel the pull?
Yes, teacher.
Okay, let me see. I only can see if you feel it or not, but I cannot say who did it or not. No. Okay, great. Pablo, Alejandro, Sara, Andrea, Laura. Okay, great. There is one student who didn't feel the pull. Please stay at the end. The people who got it, if you want, you can leave. And well, start checking Tomorrow I'm gonna send the last the final homework file and the last presentation in order to start studying to the final test with the last presentation previously. I mean, because if I don't consider correct that on Monday we have the last class and Tuesday an evaluation from that class too, right? It's not correct. That's why I'm gonna send the presentation tomorrow in order to get this information and have the chance to make homework. Okay, as you know, the ones who fill the pool and download the file, if you want, can leave the class, that's all. It's a little shorter than previous ones. And if someone, well, the one who didn't fill the pool, I think will stay. Okay. All of you get the file, right? Okay, thank you. See you. Elena, I'm gonna send you the file in some minutes. Please give me some minutes, okay? Jimena, are you there? Can you hear me? Jimena, well, I'm closing this. That's all for this night, and I have no extra information to give. So, see you Monday. See you tomorrow in the last workshop. Have a great